We are here with one of my favorite people ever, Susan Yara, and we're treating her melasma today. We have our PicoSure Pro laser warming up. That's the treatment that we're doing today. Susan is probably one of my most favorite melasma patients because she is extremely consistent with her routine and with her treatments. And melasma is one of those conditions that you experience 2 steps forward, 1 step back, right?
Totally. Even this after this first PicoSure treatment, I was just telling Nina. By the way, I'm super numb. My face is super red from the numbing. But I was telling Nina that I could tell that it was working because it broke up my melasma, but then also sort of brought it up to the surface a little bit more.
Yes.
So I'm excited for this second treatment.
Yes. That's exactly what melasma does. You know, it breaks up with the different types of treatments that you do. So obviously you're like the best at your at-home skincare routine. We've done chemical peels, we've done clear and brilliance. So we've done multiple different modalities, and that's the most important thing about melasma is that you're hitting that pigmentation at different levels, and you are really doing everything you can to control your triggers. But it's hard sometimes, right? Like there's internal triggers, there's external triggers.
Yeah, I mean, for me, the hardest thing is that 2 things actually for me. One, I live in a hot environment, so I step outside and I feel like my melasma flares. The second thing is that I have thyroid issues, so there's a lot of that if I'm not controlling my thyroid, then I can tell that.
So thyroid conditions are autoimmune, so anything that's going on internally in the body can really affect the melasma that comes out on the skin.
Which means it's never going away, so Nina's got me for life.
That makes me extremely happy.
Me too.
But what we can do is we can definitely minimize those flares, and we can make it so that it is controllable.
Yeah, so let's do it.
Here we go.